Hi, I'm Dr. Lindsay Trottier. I'm a doctor of acupuncture and Chinese medicine practicing in San Diego, California. And today I'm going to share with you how acupuncture works for problems with the nerves that lead to numbness and pain. So I'm going to highlight two cases. Both are a little different. The first was a man in his 50s who came into my office with extreme burning pain in his neck and upper back that led to numbness and loss of function in his arm and hand. So I'm going to read from my notes a little bit more about his case. So he came to see me July 8th, 2019 for his first visit. He rated his pain an 8 out of 10. It was burning pain in the neck and upper back, and he couldn't make a fist. He had no feeling in his fingers. Okay. We did the treatment and he started to feel instant pain relief. He still had a little bit of numbness, but by the fourth treatment, the pain in his neck, upper back, and shoulder had decreased by 50%. By his fifth treatment, the pain was from only now the elbow down to his fingers, the neck and upper arm and back where the pain was relieved. By the sixth treatment, his pain had decreased by 75%. By his ninth treatment, he virtually had no more pain, and now we could focus on eliminating the numbness. So generally, we see that the pain will go away first and the numbness will follow. Numbness usually takes longer to develop, and anything that takes longer to develop usually takes longer to recover. Okay, by his 12th treatment, his grip had improved, his fine motor control had improved, and he noticed an increased sensation in his hands. All right, in the beginning, I had him coming in almost every day the first week, and then we went to 3 times a week and then twice a week. Okay, the first week he came in 5 days in a row. Because his condition was fairly acute, it was debilitating and he couldn't work. So his commitment really helped him see fast results. As of November 6, 2019, he had a total of 33 treatments by October. So he started in July. He was able to go back to work, and some of the things he was doing at work were exacerbating his condition. So we didn't have complete time to rest and recover. But by October 28th, he no longer had any numbness in his hands and fingers. Okay, and he was coming in through November just for maintenance, and he would still get residual stiffness in his neck and shoulders, and some stiffness in his fingers due to overwork. So you can see within the first month, he really had a big decrease in pain. He was able to still work after 1 week of treatment. He took 1 week off and was just doing treatment. And then after that, he was still able to work, and we worked on increasing his motor control, his sensation, and decreasing his pain. And he had a good amount of success. And then he just comes in for maintenance now. The second patient has had pain and nerve problems for a different reason. She had a left knee surgery to repair an ACL injury, and she had a nerve block for the procedure, and the numbness didn't go away. The procedure was done in May 2019, and she came to me for her first visit in August 31st, 2020. And she was told that the numbness might not go away by her surgeon and other physicians, and the damage could be permanent, but she wanted to try acupuncture and see what we could do. So even within the first visit, we could see a little tiny change in the area of numbness. But again, numbness does take quite a few more treatments. I hope to see some instant results, but realistically, it can take anywhere between 12 to 20 to get a big notice of difference. But she had good success. She started coming to see me 3 times a week in the beginning, and then down to twice a week. At first, the numbness extended her entire thigh, and it was a very broad area. And with treatment, We saw the area shrink, so it wasn't the entire length of the thigh that got shorter, and the width of the area also got narrower. Okay, she also had different areas where she was having nerve problems, numbness, tingling, due to other reasons, not surgically related, but because of her injury to her knee, she had altered her gait, and so she also had a very physically demanding career, was on her feet a lot, and so she had some back problems, possibly some sciatica related issues that were also resolved during this time with the acupuncture. Those areas of numbness also went away. But what was also interesting about the area related to her surgery was that during treatment, while she had complete numbness, while the numbness started to dissipate, she actually started to feel pain in the knee again. And that was actually a good sign for me because it really showed that the numbness was going away and that there was an underlying condition that still needed to be addressed. So within a few treatments, the pain in that knee also went away. Her numbness continues to dissipate. Her condition continues to improve. At this point, as of today is January 7th, 2021, I have treated her 29 times. And she's still coming in weekly and we're still seeing improvement. So I just want to share these success stories. While numbness is a harder condition to treat, it does get better for many patients if they are committed to putting in the time and effort of getting treatment. Okay, so if you have any questions or you want to reach out to me for treatment or consultation, you can go to my website, lindsaytrottier.com. You can come visit me at my new clinic, Level Acupuncture. I look forward to hearing from you and seeing you soon. Thanks. Bye.